I'm Dr. Michael Howard from Plano Orthopedic and Sports Medicine. My specialty is shoulder and upper extremity. Today I have a young man that has had a history of shoulder dislocations. In the past he had had an arthroscopic labral repair to help control that. Unfortunately he recurrently dislocated his shoulder. Subsequently he had an open repair and he subsequently dislocated from that. Several years later, he continued to have dislocations, was referred to another specialist who recommended that we take care of him. And today we're going to do what's called an Open Latarjet Procedure, where we insert a bone graft from his own coracoid to help him stabilize his shoulder to help prevent any further chance of him dislocating. So as we go through, I'm going to show you the imaging that we look at when we get ready to prepare for this surgery. We have an MRI and a CT scan. These are both MRI sequences, and they help me measure how much labral damage or bone loss is present. And I use these calculations with numerical values here to help me determine what is the best surgery for this patient. And today we're going to do a coracoid graft, where we're going to take a part of this bone right here and insert it on the front of the glenoid surface there to keep it from dislocating. We're looking for some of our normal anatomic landmarks, and they are a little bit altered in these revision cases like this. And so it really comes down to experience and the number of these procedures you've done. So fortunately, I've had the opportunity to do a lot of these in my career for these revision cases. Take the Mets, please. All right, thanks, Amanda. We're just finding that natural fade between two muscle groups so that we don't actually have to cut any muscle. So we want him to be as strong as he can be. Really want this to hopefully be like he never dislocated it before. So the recovery time about this is about 4 months typically. And then we usually try to hold off on full contact sports for about 6, which can't always happen just based on sometimes athletes' season activities and where they are in their career. You have to come back earlier, but usually for recreational athletes, the 4 months seems to work out really well.